Hi, Dr. Francavilla here, and I'm here with resident physician Dr. Ogle. She's doing an obesity rotation with me this month. And last week we were talking about the 3 things that I think anyone needs to do before they have a conversation about weight with their patient. So we talked about 3 things that are key to do before you initiate that conversation. First of all, you need to ask for permission to discuss someone's weight. Once you've done that, you need to screen for eating disorders. So if you actually have a patient with a strong history of eating disorders or who currently actively has binge eating or bulimia, you're gonna make the situation a lot worse if you give nutrition advice before you have addressed that issue. So make sure you've screened and appropriately treat those instead of the weight if you discover an eating disorder. The next thing you need to do is get a weight history. So before you go farther into counseling someone on weight, you need to find out what the situation is with their weight. Just like any other medical condition, you don't want to jump into treatment without a history. So in terms of that weight history, you want to find out where they are right now in terms of their heaviest weight. So is this the heaviest they've ever been? Sometimes you'll see someone who has a BMI of 35 or 40, but they've already lost 100 pounds. So at that point, you may not counsel them further about their weight. You may just congratulate them. And if they have no metabolic issues or any other issues or concerns about their weight, just say, fantastic, you lost 100 pounds, keep doing what you're doing and move on. I've definitely seen people in my practice who've lost 100 pounds and then had a physician tell them they need to lose more. They get very frustrated and sort of give up, and then at times have regained that 100 pounds. So don't be that person. And then finally, getting a nutrition history. It's also very disingenuous to give people advice about nutrition before you find out what they're eating. Just like any other medical condition, you'd want to find out more about the knee pain, what causes it, before you tell them what to do about the knee pain. So find out what they're eating. You can do that really quickly with a 24-hour diet recall, or just asking questions like, what do you normally have for breakfast? What do you normally have for lunch? What do you normally have for dinner? What do you have for snacks? What sort of beverages? What are cheats, treats, indulgences? And you can get that diet history in just a couple minutes asking those questions. If a patient doesn't know what they're eating, that's a bad sign. Send them home with some diet logs so they can figure that out. So we had gone through that really briefly last week, Dr. Ogle, and then you said you got to see a patient for weight in your residency clinic since then. So tell me sort of how that went and what of those pearls you used.
Yeah, so last week I had the opportunity to implement these strategies during a weight consultation that was scheduled in my residency clinic. And I step-by-step went through those tips, and specifically with the nutrition history, we just did a 24-hour diet recall. And then afterwards, the patient actually verbalized to me how appreciative they were with me taking the time to get that history, because they said in previous appointments with other providers, they went straight to nutrition advice or medication options without actually figuring out what the patient has done in the past or is currently doing. And so it just made the appointment go so much more smoothly and efficiently, and we were able to be very specific and tailor recommendations to her particular needs.
That's so awesome to hear. So yeah, so again, number 1, permission to initiate the conversation about weight, screen for eating disorders, get a weight history, and then get that nutrition history, because people really do appreciate being heard. You'll often find that they're eating pretty healthy. Maybe they just need a few tweaks before you give them advice. All right.